So Pirtobrutinib, is a BTK inhibitor. It's a non-covalent BTK inhibitor. And if you look at the studies which have been done or reported so far, it can still have some of the same side effects we have seen with covalent BTK inhibitors, but at a lower frequency. So if you look at the studies, patients can still have atrial fibrillation, but at a low rate. There could be increased risk of bleeding, but at a low rate. But otherwise, it's a very well-tolerated drug. So I think if you compare, again, cross-trial comparison, because we don't have a head-to-head comparison of Pirtobrutinib with other BTK inhibitors yet, though there are ongoing trials. So we can only compare it to what has been published with other drugs, and cross-trial comparisons can have several biases and caveats. But with that in mind, the safety profile of non-covalent BTK inhibitors seems to be pretty favorable. Again, they're not free of those BTK side effects, but it seems to be at a lower frequency. So I think the management part is pretty much similar to what we do with covalent BTK inhibitors. If a patient were to develop a bleeding complication, you will have to stop the drug, hold the drug, maybe resume depending on the bleeding at a lower rate later. If a patient develops atrial fibrillation, then you have to weigh in the risk of anticoagulation and bleeding. Again, similar management, I would say, as we have been doing with covalent BTK inhibitors.